I'm about to record chapter 5 on culture implication. As we talk about culture, we look at um, minorities and the minority status. This basically definition here of minority and the minority status. The status not always few in numbers, but lack political power, social power, and they may be treated differently. They also may be discriminated against as well. As we look at some more cultural implications, we look at race, ethnicity, and also cultural. Again, when we caring for our clients, we have to take in consideration their cultural beliefs, their values, their practices. So again, we must know one's culture. This is why we do a good, history and physical. I mean, collect data on our clients, get a good history. Measuring race and ethnicity in the United States, we use the United States Census Bureau. What it does is combine race, ethnicity into a category. The purpose is to give a good description, help the government determine and understand the needs of its citizens. Also, the census can be used to identify disparities in healthcare along those racial lines or ethnical lines. Traditional, Western tradition, identify we identify those individuals' identities found in individuality, rather. We look at the value. They're very autonomous. They are also very independent. They're separate lives. They believe that the mind and body is they're separate entities. So the diseases have a measurable cause. They feel that diseases has a measurable cause. And treatment, they look at aiming at treating the cause of the illness. And also they are very they look at success by preparing for the future. As far as our Eastern traditions, they have a family base for identity. The mind and body splits also in one entity. Time is circular, also is reoccurring. The bone is into a fate. It has a duty to comply. They feel that diseases are caused by frustration or fluctuation, I'm sorry, and opposing forces. This is what their beliefs are. Also indigenous, I'm sorry, culture. They place this emphasis on place of humans in the natural world. They also their basis of entity is tribe. Um, they believe that a person is an entity only in relationship to others. And then when they look at disease, they feel like it's a lack of harmony between the individual also and the environment. So we have to take in consideration of one's culture. Let's take a look at this case study. Mr. H was with his daughter, uh, who lives with his daughter, was has become concerned about his memory. His daughter has. Sometimes he say he's going out to the guard, but then he just disappeared. Yesterday, she said she was frantic. Then a neighbor brought him home from the shop. Nearly, he was about a mile away from home. And when she said, "Dad, where were you trying to go?" He said, "I don't know. Did I get there?" Sometime I think he believed he's back in Mumbai. As far as our question, although his daughter has been here almost 15 years, Mr. H is a fairly new immigrant. He speaks some English and he's highly educated. His daughter has mentioned he is from Mumbai, India. Which attitude, I'm sorry, would you expect him to share? What attitude? And the answer is B. He believes that if this is an Eastern tradition and believe that diseases is a part of one's fate and we have the duty to comply. So that's basically what that's based on his tradition. So the body, the mind, and the spirit are considered a single entity. Is what they're saying. There's no sense of separating it between a physical illness and a psychological one. Okay, so again, one is born into an unchangeable fate, which he has the duty to comply. So this client believes here that the mind and body is one single entity, so there's no need to separate it. Okay, the impact of culture. Again, as we talk, we know that communication, verbal communication, how we communicate, our etiquette. Again, we look at enculturation. Basically, this is beliefs and values. This basically is enculturation. It's basically how the world views things, their beliefs, their values, and practice to its members. And then you ethnocentrism, the universe tendency of humans. They think the way they think. Okay, they behave in only that way, in the way that they think. Okay. Also, cultural imposition. Basically, this possession which people or groups of people try to impose their own values and patterns of behavior on others. So therefore, we cannot impose our values, our cultures on one because of their beliefs and their values. Okay. Defiance is basically from cultural expectation. This can be defined as illness by other members of the group. Okay. So again, culture and cultural values play a critical role in how we take care of our clients. We have to take in consideration their culture and respect that. And barriers to some cultural barriers. Again, I mentioned earlier communication, stigma, the stigma that we places on mental health. And we sometimes we misdiagnose clients because we stigmatize them. And I think I talked to you about clients the other day about how they may have some physiological issues, and they're misdiagnosed instead of psychosocial issues. Cultural concept of distress again, also genetic variation and could be some barriers to care. And when we talked about somaticization, where clients may just complain, but there's really no physiological problems or defined or they've been diagnosed with. So they are just called somatic disorders, which we'll talk about that later on. So again, stigmatization of mental illness in cultures where the body and mind are considered one entity, again, we stigmatize. So culture in which there's a high degree of stigma associated with mental health problems. Again, we stigmatize clients again because of their what culture and their beliefs and their values. And these are some clients that are at risk. We talked about those clients that we looked at those healthcare disparities. We look at the immigrants, those refugees, cultural minorities. So Mr. H is definitely an immigrant. He was brought here by his daughter 2 years ago, who expresses she who so expressively rather, so she and her partner could take care of him. So they wanted the dad to come come here to the United States. Immigrants and their family they go through a problem of acculturation. They go through culture shock. Um, they sometimes they choose to move in new location, looking for better changes in life or better jobs, better health care. But refugees, they are forced to leave their homeland and escape certain conditions. So you have a difference between the immigrant, which they chooses to come, and a refugee is forced to come. Then your cultural minorities, they're vulnerable population. They're very vulnerable. They're taken advantage of. They are discriminated against also. These are basically some congruent competencies associated with culture. These are five constructs of culturally effective care. We have to be cultural aware of our clients, have a cultural knowledge, must encounter with our clients, must also skills, and then cultural desires. So cultural competency, basically, like I said, it's a process of demonstrating culturally congruent practices. So we have to apply that evidence-based knowledge that we know to these clients, so we can take care of them, taking into consideration their values, their beliefs, their practices as well. So as again, I got a little bit ahead of myself. As we look at awareness, we're looking at those beliefs, those values, recognizing those clients that they are different based on their culture. So must provide a cultural climate that's competent or for that client and the nurse. So that the nurse must provide a structured environment that's culturally interested in those clients. Cultural knowledge, again, learn by attending cultural events. This is how we can enhance our knowledge, develop, enhance our competency. Learn by studying, looking at differences that help us establish a rapport with our clients. Ask those culturally relevant questions, looking at the value, cultural variables, I'm sorry, to be considered. Like I said, there going to be some variables there. It could be a communication barrier or variable. So again, taking because we must have a knowledge, be knowledgeable. And encounters. This is where when we learn, we develop that competency. It's going to deter us from being stereotyping. It helps us to gain confidence in cross-cultural interaction. And it also helps us to help nurses avoid and reduce that cultural pain. And then skills, like I said, we must have the ability to perform cultural assessments in a sensitive way. Use professional medical interpreters to help us with meaningful communication. There are some cultural sensitive tools that we can use. And again, make sure that our goals are mutual, they're acceptable by our clients, and that they are capable of producing those positive outcomes. Okay, these are client-centered goals, not nurse-centered. So Mr. H is admitted to your unit. In your assessment, you identify some cultural patterns that may support or interfere with his health and his recovery process. So what can you do? What can you do, you think? So again, the nurse may be very accommodating. We can be very receptive of that client culture. We can seek some professional help. We can use those cultural sensitive tools, assessment tools, and we may have to get an interpreter in. Okay? Cultural desire. We must provide that care genuine. Have that, make sure we provide it, that we're genuine, can show that concern to our client. Listening. We've got to look at that client, look at their viewpoint, make sure we understand, be patient, and be considerate, and also show empathy. We have to treat our cultural client just as we would anyone else. Which worldview would the nurse anticipate from a client who say it is important to save enough money to take care of yourself in your old age? What we should not rely on anyone else to take care of us. This is which culture you think this would be. And we said early on that Western tradition, in the Western tradition, one's identity is found in one's own individuality, which they are autonomous. Like I said, they're very independent and they are self-reliant. So again, this person would want to, in the Western culture, they would want to take care of themselves. They want to have enough money so they can take care of themselves. They want to be independent. They want to be self-reliant as well. Which term refers to the individual belief that their cultural values and practices are correct and superior to those of others. And this is going to be ethnocentrism. These is the universal tendency of humans to think the way that their way of thinking and behavior is the only and correct way. So these individuals think that the only way that they think that I'm sorry, I got it this twisted. They think that their way is the only way to think and behave. So again, our culture is going to be different. No matter what we do, they're gonna whatever they think, whatever they believe in, is that's their way of what? No way. Okay. So that basically kind of sums up cultural implication chapter